Welcome to the Growth Mode podcast, where real conversations fuel real business growth. Hosted by Nina Labbe, media strategist with Salem Surround. Get ready to listen, learn, and grow. This is Growth Mode.
What if great healthcare didn't mean waiting weeks for an appointment, sitting in crowded waiting rooms, or bouncing between multiple offices? Today on the Growth Mode podcast, we're talking about a healthcare model that's changing how families experience primary care. And it's new in San Antonio in a very big way. And my guest is Dr. Joshua Beck, Medical Director of Sanitas Medical Center, a modern patient-centered healthcare organization that's opened 9 locations across San Antonio and brand new to our market. We're going to be talking about what makes Sanitas different, how they're using technology and integrated care to improve patient outcomes, and what this expansion means for families across our community. So whether you're a patient, a healthcare professional, or just curious about where healthcare is heading, this episode is full of insight and hope. So let's get started. Dr. Beck, thank you so much for being a guest on Growth Mode.
Thank you so much for having me, Nina. Yeah, I'm so glad to be here.
Awesome. So we gotta find out your story. So tell us a little bit about you and what inspired you to go with Sanitas.
You know, I'm from San Antonio, and although I did my studies elsewhere, I went to med school in Guadalajara, and I did my residency in Iowa, and I've kind of been, all over the U.S., I would say. Mm-hmm. San Antonio is home. This is, where my family lives. My parents live here. Yeah. One of my sisters lives here. And so, I liked, coming back to San Antonio. I've been in San Antonio working as a doctor for at least, I think, 15 years, maybe.
Okay.
And so I liked Sanitas, when I came to find out about Sanitas.
Yeah.
I like the Hispanic culture. Yeah. It's a Latin environment, a Latin culture. It comes from Miami. Mm-hmm. Sanitas has been in Miami and Florida for about 10 years. Mm-hmm. And so I like that. Mm-hmm. I like that it's, value-based. Mm-hmm. It's a value-based care model. We can talk about that a little later. Mm-hmm. And, I like the opportunity, to be able to open the Sanitas doors, with these 9 clinics that we have to, the people of San Antonio, right? To, find, physicians and nurse practitioners who also come, many from a Hispanic, or Latin background. Yeah. And so it's kind of the same culture, and so, there's a big Latin, culture here in San Antonio. And so I think it's, it's great. It's a good,
San Antonio
good
is great. Yeah. I love San Antonio. All right. Well, awesome. I'm glad you guys are here. So, for those that are new to Sanitas, can you share, what the Sanitas Medical Center is all about, all the services you offer, and the mission behind your model of care?
Yeah, I would say that the mission behind the model of care is more of a preventative, mission or preventative care. Mm-hmm. It's a value-based care model. So what we like to do is we want first and foremost, I would say patients to feel at home, feel that, their family, right? We're here to do what's most important, right? Take care of their care. And it's not only taking care of their medical care, right? But it's taking care of all aspects, treating that patient as a whole person, right? All aspects, whether it's, the social factors, that influence, their medical conditions that they may have, taking care of their medical conditions, helping them out entirely, right? And so Sanitas, we try to spend more time. We actually spend about 50% more time with our patients than other traditional primary care clinics.
I like that.
We have an integrated model. Mm-hmm. And so in this model, we develop relationships with the specialists that serve our patients, right? So that, they're seen in a timely manner. Yeah. So that they're also practicing, good care, make sure that we're not overutilizing services, right? Making sure that we're doing what we need to do to take care of these patients.
Yeah.
Many of our clinics, have, local providers, local, physicians and nurse practitioners, right? That are from San Antonio.
Yeah.
And so they're aware of the community, right? This is where they're from, right? And so they understand, patients from San Antonio.
Yeah.
We have X-ray, at one of our locations. We've got ultrasound that bounces back and forth between a couple locations. We have point of care testing, which is basically lab services where we do certain lab tests, and we get those results the same day, like real time.
Oh, that's nice.
Which is great. We have, lab modalities, so we can, draw labs on our patients, and send them out. They don't have to go to a lab facility to get their labs done.
Oh, that's convenient.
And, and then we also have a relationship with a hospital system here, Tenet or Baptist.
Okay.
And so, that's the hospital system, that we would direct our patients to. And so this is this whole integrated model, right? Where we try to help the patients with all their needs, right? If they need to go to the hospital, if they need to go see a specialist, if they need to be referred out, for whatever reason, we try to do what we can to take care of the patient. Right?
Okay. I love that. I love that. So you got to tell us what inspired Sanitas to expand in San Antonio and why launch 9 locations right from the start? Yeah.
And so I think, Sanitas, has, their kind of philosophy is, one, having that reach, right? Patients being able to access a clinic, right? And being able to go and not, for example, in San Antonio, not drive, a far distance to go to a clinic. So I think that was the thought behind the 9 clinics. San Antonio is a big city as well, right? There's a lot of patients. The patients that we serve are primarily the Affordable Care Act or the Obamacare patients. And so we kind of, chose, areas, suburban areas in San Antonio where those patients reside. And so that they would have a Sanitas clinic close to them. Right. And so that was the thought behind the 9, right? To really target San Antonio as a whole and allow patients access, to these 9 locations based on where they live. And I think, apart from that, they're all modern, they're all refurbished, remodeled, modern facilities with an open concept, very clean looking, and so I think it's great,
I love that because now it's convenient for someone to find a clinic that's near them. So that's perfect. So what sets Sanitas apart from other primary care or urgent care providers like in the area?
Yeah, and I think, we offer both primary care and urgent care needs, right? So we have same day appointments. And so I think that sets us apart, rather than going to, contacting a clinic, right? That's the other benefit of the 9 clinics, right? Is, if you just have one clinic, to get in to see that provider if you're sick today, maybe next week, maybe 2 weeks, maybe you're dead by then. No,
same day appointment is not common.
No, it's not. And so these clinics offer these same day appointments, right? But even though, let's say you're a member of one Sanitas clinic, I mean, we have 8 other clinics, right? So let's say, you're sick and for some reason that clinic is full, you're able to seek care at any of the clinics, any of the Sanitas clinics. So just because you belong to one clinic doesn't mean that you're limited to that clinic. So there's that benefit of having access, to these other 8 clinics.
That's great.
So same day appointments, I would say more quality time spent with the provider. We partner with United Healthcare. And so we, with this partnership that we have, we've removed a lot of the administrative barriers, that patients have, to get care. And so, it's really easy. They walk in, they're able to be seen. They have more time with the provider. It's integrated, right? We help them with all the care. We have not only, what I had already mentioned, but we have a program called Be Well, which is a mental health program. Very, very important, right? What primary care clinics have, like a mental health program where you can get counseling. If needed, there is a consulting psychiatrist that can review, that.
So this is all under one
experience.
roof.
All these clinics
amazing.
have that, and so the Be Well is for, patients with anxiety and depression. We have a chronic care program as well. So that's where, we have a coach who will coach patients who have prediabetes, diabetes, hypertension, COPD, congestive heart failure, chronic conditions. We have another program within that care program that serves high-risk members, right, with care coordinators. So we help coordinate the care of these patients, out of the hospital, out of the ER if they went to the ER, making sure that they see their primary care provider, making sure that they go see their specialist. And what are we trying to do? We're trying to reduce hospital admissions, right? We're trying to keep them out of the hospital, keep them healthy, keep them seeing us. We want them to see us.
And a person would rather not go to the hospital.
Exactly, right?
Yeah.
There's more risk of, other infections, right? Getting pneumonia, getting other things. And so it's good. We want to see our patients. We want our patients to come to our clinics, see our providers, develop that relationship, develop that rapport, feel like they're part of the family because they are part of the family.
Yeah. So when you say you treat the whole person, you mean it.
Yes.
That is so impressive.
The medical aspect, the psychosocial aspect, if they have, other social determinants of health, if they have, housing issues, food issues, issues, paying for food or whatever, we will help them.
Wow.
And United Healthcare will also help them.
That's amazing.
Find resources, to help their needs. So,
wow.
Yeah.
I love that. That makes y'all so unique.
Thank you.
Yeah. So can you walk us through a little bit more about what makes your model different? And I know you mentioned that you're very patient centered, but anything about the model that makes it different?
Well, I would say, it's kind of what we discussed, so I think the access to care is the most important thing, right? Getting that same day appointment, being able to be seen. And then, apart from a traditional, fee for service clinic, where, you may see a patient, you put in referrals, you refer patients out, for different studies, which may drive up costs. And so here in the value-based care model, we really like to take care of our own patients, right? And only refer out when necessary, right? So we want to make sure that we do what we can ourselves, our providers, to take care of our patients.
Right.
And when patients need to go see a specialist because they have a certain medical condition or they need certain imaging studies, then we refer out. So it's an integrated care model, which is very different from a fee-for-service model, right?
It sure is, yeah.
And the relationship that we have with, our extensions, right? The specialists that we serve, the facilities that we send our patients to. We want to develop, and we are building those relationships so that when they see one of our members, they're going to say, or if they have to go to the hospital, they say, oh, this is a Sanitas patient, right? Yeah. So we're gonna get in contact with the clinic, the case manager at that clinic to inform, the case manager of one of their patients, whatever it may be. So that's where the integration comes in. Whereas a fee-for-service clinic, well, a lot of times, you don't know, right? Until you see the patient again.
Yeah, exactly. I love that because you go above and beyond. Any more examples on how y'all go above and beyond to meet patient needs?
I would say, outreach in the community. I would say, we, at this time, we don't have this service, but we have plans for, virtual care on demand. So many people have heard of, companies that do, virtual care when you're sick or you can't be seen. We do have virtual care visits right now, but we don't have on demand. So on demand is after hours and on the weekends. That's something that we will be rolling out.
Oh, wow.
So if you're sick after 5, or it's a weekend and you fell and you twisted your ankle and you want to talk to one of our Sanitas providers, that's something that'll be coming down the pipeline.
So that's like an urgent care service.
That would be like like an urgent care after hours service. So that would be something that we would do.
Yeah.
We don't have this right now, but at some point, there may be an option for home health, right? For patients that, maybe they got out of the hospital, maybe somebody had a stroke, and they can't leave their home. And so maybe sending a provider to go see them would be the way that would be beneficial. And so they do that in Florida.
Yeah.
And so these are things that can be added, as we continue to grow.
Yeah.
And so those are, things that we're thinking about, right? I think those would be great, extensions to, the primary care service that we already have in place.
So much to look forward to.
Yeah.
Awesome. So speaking about community engagement, so as you enter this market, how important is community involvement in building trust with local families?
I think it's very important. I think it's important to build not only trust with local families, but I think it's very, very important to, connect with people who are engaged in the community, those community, people that want to be volunteers, right? That want to help us out. Maybe they will point us in the right direction for, community resources, right? Workshops for patients, maybe workshops for patients that need education about diabetes, for example, right?
Yeah.
Or maybe they, have bereavement issues, right? Where they lost a loved one and they need to, also talk, or be in a support group where people have had, that issue or traumatic experiences. And so I think it's important to not only do that, I think it's important to just really involve the entire community.
Right.
We've had, great opportunity to meet, for example, the mayor of Leon Valley. We have an open house coming up next month, and we'll meet, the mayor of San Antonio, I believe, as well as, local community leaders. We've had an opportunity to meet people from the Hispanic Chamber of Commerce. And so anyways, I think, involving the community, letting the community know that we're here and we're here to stay. We want to embed and become part of the fabric of the San Antonio community. And we want the community to know that this is a long-term commitment for us.
It looks like you're doing it all the right ways.
So that's what we're trying to do, and we'll continue to do that.
I love that. All right. So, so what do you want the San Antonio community to know as they start to see Sanitas pop up around the city? I know you've already told us about all the wonderful things to look forward to. What else?
We are here to, to serve you. We're here to meet you. We would love for you to come to one of our, 9 Sanitas locations, tour the facility. We have at certain facilities, we've got, United Healthcare brokers there to answer plan questions. We would love to come and introduce you to our Sanitas family, right? Our providers, the Given Clinic, the staff. They're wonderful. Everybody's here to serve you, right? And so we would love to have you. Yeah.
Wonderful. All right, so let's talk about how Sanitas makes care easier and more accessible. What role does technology play in how Sanitas delivers care, whether through telehealth, digital tools, patient apps, etc.?
Yeah, so thank you for bringing that up, Nina. We have a My Sanitas app.
Okay.
And so that My Sanitas app, is an app that in the future will serve as an app to help with those video on demand. Okay. Right? Kind of like, other companies like Teladoc, has an app. So we'll have video on demand. We have the ability through that app to schedule appointments. You have an ability to review your charts, and, see what your doctor said, as far as treatment plan for certain, conditions that maybe you saw your provider about. And so there's that technology piece. For patients that, maybe have a different cultural background, they speak another language. We have a service called Language Line. So we will have, assistance for providers that maybe don't speak a certain language, and we have translators that help, kind of help coordinate that translation between the Sanitas patient or member and their provider. So we have that piece. And then I think, the ability now for our providers, to see patients virtually, if they can't make it, maybe they got a flat tire, or maybe, you know, they're working 2 jobs, you know, and they really need, you know, and they're taking care of their children and they need to be able to see their provider virtually. So I think we have that piece. And then also, you know, helping with, you know, as I had mentioned, you know, reducing these administrative hurdles with our patients by, you know, when they do need to go see a specialist, you know, processing those referrals in a timely manner, making sure that, you know, we're able to get those, you know, those members to their, you know, their specialists when they need to be seen for conditions that require, you know, an extension of care beyond just what we, you know, what we can offer at our primary care clinics.
Yeah, I love that because you've removed so many barriers to care, such as wait times, language, accessibility. You know, that's amazing. So let's talk about growth, expansion, and community awareness. You know, Sanitas is new, you know, to the San Antonio market. What are the most important things you want patients to understand about your model of care, you know, as you build awareness here?
Yeah, I would say, you know, the access to care is always going to be number one, always going to be number one. I would say the second aspect is we try to focus a lot, you know, as I'd mentioned, you know, we have providers and staff who are from this community. And so they understand the community, they understand their needs, they understand where they're coming from. And so just knowing that we try to hire locally, you know, we try to hire, you know, bilingual providers, you know, bilingual staff, right? We know that we have a lot of Spanish speaking, for example, you know, community members. There's a lot of people from Mexico and from Colombia and Guatemala and from other you know, other countries, right, in North America and further on south. And so we want, you know, patients to feel comfortable, right, talking to a provider or staff who understands them, you know, who can relate to them and their needs and where they're coming from. And so, you know, I would say, you know, that's really big. You know, I mean, Sanitas, as I had mentioned, you know, comes from Miami. You know, everybody knows that Miami is like a Latin hub, right? You know, with that whole Latin environment. And so, you know, that comes, you know, to play. And so, and then just know that this is a long-term commitment, right? We're here in San Antonio. We're here to stay. And we're here to partner with, you know, our members long-term, right?
I love it. All right. So how do you maintain consistent standards of care across multiple clinics while still making sure each location meets the unique needs of its neighborhood?
Yeah, I would say a lot of that has to do with just, you know, it's a challenge, right? And I think it's a challenge not only for us, but maybe for other, you know, multi-clinic, you know, companies. But I think that has to do with really engaging, you know, our staff, particularly the providers, right? You know, who are seeing the patients, you know, to develop a standard of care amongst all the clinics. You know, in this value-based care model, we really try to focus on prevention. I think prevention is key. Vaccinations are something that we're going to have at the clinics, and that actually will be rolled out. We opened our doors, you know, in January, right? And so this month, but we will have vaccinations next month available. So that's another, you know, perk, right? Is that you can get, you know, your vaccines. You don't have to go, you know, elsewhere for the majority of vaccines. But I think developing, you know, that standard, you know, with prevention, with evidence-based medicine, which basically means, you know, treating patients with what we know works, right? You know, what we know that other, you know, that's the standard of care amongst, you know, doctors and providers, you know, practicing good medicine.
I gotcha.
And then giving the patients the time, right, to go over, you know, what they want to go over. Right.
So you have a partnership with United Healthcare, like you said. Does that mean that patients that come see you need to be with United Healthcare?
Yes. Right now, the patients that we see are, you know, or will be seen are United Healthcare members. It's an exclusive membership. It's a plan that was created for Sanitas in partnership with United Healthcare. And so, you know, it's as I mentioned, it's an exclusive membership. Their United Healthcare card says, United Healthcare Sanitas.
Okay.
And so, which is great, right? Because when they see the specialist or if they get sick and they have to go to the hospital, everybody will come to know that, that's a Sanitas patient, right?
Yeah.
And so we want to develop that relationship with the community. And I would say, so we see, United Healthcare members, but we also see, we have some patients that are just private pay.
Oh, okay.
And so that's kind of the scope of what we see right now.
Okay, gotcha. All right. So let's talk a little bit about leadership and vision, Dr. Beck. As medical director, what excites you the most about leading this expansion into San Antonio?
Well, I would say, we've set the groundwork, right? We've set the foundation for Sanitas in San Antonio.
Yeah.
We want to continue to grow and develop this relationship with the people of San Antonio, with the community. We want them to know, like, as I mentioned, that we're going to be here long term. This is a long-term commitment. We want to be embedded in the fabric of San Antonio, and then hopefully expand, right? I think that would be great to expand and provide the Sanitas experience, the Sanitas service, this integrated care model to other markets, right? To expand to other cities, in Texas and maybe in other states would be great. I think that's on the horizon.
Awesome. All right. So, so let's talk a little bit about future goals. What does success look like for Sanitas in San Antonio over the next 12 to 24 months? So you've mentioned so much already.
I would say keeping the members that we have, the members, as we had kind of discussed, before, before the podcast started, some of the patients that we have, were kind of, became Sanitas patients. They were already part of United Healthcare. They have the option to stay with us, or not. I hope that they do. I hope they see the value in what we offer, the value in what we bring. They see the benefits of, what our providers offer, the services that, we discussed that we have. Which, many other, clinic models don't have or lacking, especially in San Antonio. I don't think that we have in San Antonio or Texas for that matter, a similar, another company that offers kind of what we offer. I think it's a real unique experience to Sanitas. And so I think, having our members, see the value in that. Yeah. Sharing that with their friends and family, spreading the word, and then I think being able to, to expand into other cities would be great.
I'm so impressed. What's not to love about Sanitas? It's amazing.
It's an amazing company.
So before we wrap up, how can listeners learn more, schedule an appointment, or find the Sanitas location closest to them?
I think that they would be able to, go to the United Healthcare I take that back. Sorry, the Sanitas website. Okay. They can, search for, Sanitas San Antonio, and then we will also provide, a phone number, where they can call and get more information. That's also listed on the website. Okay. And they may know, they may already know of a broker who already knows about Sanitas. So talking to their United Healthcare, affiliated brokers or agents, I think would be good.
Awesome. Well, Dr. Beck, thank you so much for joining me.
Thank you for having me, Nina. I appreciate it.
You're so welcome, and for educating us about Sanitas Medical Center and how unique and how amazing you are. I'm just in awe over everything that you've said.
Thank you, Nina. I appreciate it, and I encourage everybody who's listened to this podcast, if you're interested in, becoming a member, if you are a member and you haven't come to one of our clinics, I would encourage you to come and visit one of our 9 locations.
Wonderful, wonderful. And again, big thanks to Dr. Joshua Beck from Sanitas Medical Center for joining me today and giving us an inside look at their patient-centered healthcare model and their exciting expansion into San Antonio with 9 locations that are now open. We talked about how Sanitas is improving access to care, using technology to simplify the patient experience, and building a healthcare system that's focused on prevention, compassion, and community. If you found today's episode helpful, be sure to give it a like, comment, and subscribe so you never miss a conversation that's designed to help you grow. And if you're a business owner or a healthcare leader looking to expand your reach and build trust in your community, I'd love to help you do that. We do offer a special Get Found, Get Heard package that combines organic SEO with targeted radio to help brands build visibility, drive traffic, and generate real results. We'll take a look at where you are and how you can grow, whether it's through SEO, digital ads, or getting found locally. No pressure, just solutions tailored to your goals. You can reach me anytime at growthmode at salemsurround.com, or you can call me at 210-526-3626. And until next time, keep pushing forward and stay in growth mode.
Thanks for listening to the Growth Mode podcast with Nina Labbe. Stay connected, keep learning, and keep growing. Don't forget to like, subscribe, and share. And we'll see you next time on Growth Mode.
Want to grow your business online and on the air? Right now, when you sign up for a 6-month organic SEO campaign at $3,100 a month, we'll include a free radio schedule, 1 week per month for 6 months to help kickstart your visibility. That's a $5,000 value in radio advertising, designed to drive awareness and leads from day one. Don't miss it. Email Nina Labbe at growthmode@salemsurround.com or call 210-526-3626 to learn more.